National Healthcare Information Gathering and Reporting System, MyHDW, namely Malaysian Health Data Warehouse, was developed by MIMOS, covering all government and private healthcare facility and services. It is a trusted source of truth of comprehensive healthcare data structure for query and analysis purposes. MyHDW was officially launched in 2017 in all health facilities under public and private sectors. MyHDW as a dedicated system is optimized for the analysis and reporting of data that will be integrated, interoperable, and comprehensive. It is built based on the National Health Informatics Standard that employ overarching healthcare system governance. Private Healthcare Productive Nexus, PHPN, is one of the Nexus initiatives under Malaysian Productivity Corporation through Malaysian Productivity Blueprint. There are three main focus areas that are undertaken by PHPN, namely regulation, technology and innovation, and thirdly, workforce and performance. Under technology and innovation initiative, it is to bring forward public-private partnership, PPP, a business model that enables public and private hospitals to share resources and facilities. It is a win-win scenario. Private sector can participate more and public facilities can improve. PHPN recognizes the advancement of MyHDW and its benefit to the private sector. To upkeeping the public-private partnership business model, PHPN would like to take this opportunity to promote this system to the private sector and to strengthen the implementation of MyHDW in general and the customer care information system, namely SMRP 2.0. And thus here we are, the CEO Forum on MyHDW. As mentioned by Yang Berbahagia Dato' Latif in his welcoming speech earlier, the main objective of this forum are as follows. Number one is to increase the awareness and understanding of MyHDW system. Two, to increase private hospital participation for health data collection through MyHDW. And thirdly, share the experiences, issues and challenges faced by hospitals that have successfully integrated between Hospital Information System, HIS, and SMRP. Before commencing the CEO Forum on My Malaysian Health Data Warehouse, I would like to invite Yang Berbahagia Dato' Dr. Jacob Thomas, Champion of Private Healthcare Productive Access, to deliver his opening remarks. Dato' Jacobs, over to you.
Thank you, Tuan Haji. Once again, welcome to everybody. And I'm particularly excited about this session. And I must thank the Nexus for having organized this together with PIK. Thank you to Dr. Noraida and Dr. Ismat and so many others who have worked very hard to put this together. Now, why I think this is necessary, I think it's about 2 years ago, time has really gone fast, that Puan Nohaizam, who is the person in charge of technology and innovation in PHPN, headed a session in Pantai Hospital to talk about why is the uptake of hospitals, private hospitals, to give input to MyHDW so low. And there were about close to 200 participants. And in our deliberation, we realized that hospitals, private hospitals are giving a lot of input to MyHDW, but it stops there. We don't get back any information. So what was discussed then was, this is a really valuable source of information, which not only is good for the Ministry of Health and the government, but also very useful information for the private sector. For example, when we have all this data compiled, private hospitals will be able to access this data and find out which are the diseases prevalent in different parts of the country. And in so doing, it will help them to decide, should we have oncology services, or is it ophthalmology, or is it nephrology that is short in different areas. So in so planning, hospitals can decide what services they want to bring in. So that's why I believe that this is a fantastic tool that we can have. And I want to thank PIK for bringing this and working with us. And this forum will be able to address the different challenges that we will face. And I have the assurance from the MOH and also from MPC that we will together iron out all these challenges so that MyHDW participation will be fantastic, and we will use this as a great tool. So with those few remarks, I want all of you to not only listen to Dr. Noraida and Dr. Ismat, but also to take part in the Q&A and discussions. And your input will be most valuable in making this MyHDW a useful tool, not just for the Ministry of Health, but for private hospitals as well. And with that, thank you, Tuan Haji, for this time you've given me to say a few words. And all the best.
Thank you, Yang Berbahagia Datuk Dr. Jacob Thomas, champion of private healthcare product Nexus, on his opening remarks. By no further ado, let's begin our COO forum today. Just for the agenda today, we will begin with a few presentations and then the Q&A session. For the first presentation, I would like to invite Yang Berusaha Dr. Ismail Muhammad Sulaiman, Senior Principal Assistant Director of Health Informatics Center, HIC, Ministry of Health Malaysia. Dr. Ismail is the Senior Principal Assistant Director, and she has been with MOH for the past 14 years. 5 years of clinical experience before joining HIC. She pursued her Master in Health Informatics in Karolinska Institute, Sweden, and now pursuing her PhD in Health Informatics in University Malaya. Dr. Ismail will be looking at in the introduction of the MyHDW and also the demonstration of MyHDW. Yang Berusaha, Dr. Ismail, over to you.
Thank you, Mr. Shamsul Arman, for introducing us. Thanking Dr. for MyHealth Data Warehouse. Actually, I can. I would like to thank all my colleagues in PIK.
Dr. Ismat, you are breaking up. Your voice is breaking up.
I think the microphone needs to be a bit nearer. No, I can't. Dr. Ismail, we totally lost you, the voices.
Okay, is it?
Yes, it's good now.
Okay, we've changed the speaker.
All
right, well, let me begin again.
Okay.
I'd just like to thank Dr. Jacob for introducing us and inviting us to this session. Yes, I do remember 2 years ago. Thank you for remembering us here. Thank you for MPC, the organizer. And I'd like to introduce some of the people here in PIK. In this room, there's about 30 people. And there's our Director of Planning, Dr. Jinuddin. Is with us, our Deputy Director of Planning, also Dr. Fazila, and the Director of HIC, Dr. Noraida. So, I'm going to share my screen so that we can begin our presentation. So welcome everybody to the forum. Thank you for joining us today. Present. Yeah. Great. So good afternoon, everybody. I'll try to make sure that everyone doesn't go asleep. But I think we have to share our objective today and make sure that everyone is aligned. Basically, I'm here to talk about not just MyHDW warehouse, but how it can benefit you. You as an institution, you as a private healthcare institution. I think that is most important. I mean, I can talk about why it's important to KKM, but we are not here for KKM mainly today. We're here for you as those in the private sector as a partner to the Ministry of Health. I think the people here, I'm happy to know that those who are attending are mainly the CEOs of private healthcare institutions, because then I can talk about how important it is. And I think you would agree that now we are in a data. Without data, we can always make hunches to make decisions. But here, with the data that you've given us, actually it does go back to you, and it depends on how you want to use it. So instead of just talking about it, I want to show how it looks like, because people may have this perception that, oh, you know, I have to do statistics and this is so hard, and it shouldn't be, because we made it easy for you. But before we get to the demonstration, I do want to have a quick introduction on what is MyHDW warehouse for those who have never heard of it. It is basically a system that we've built for analysis and for a way for you to visualize the data and gain valuable insight from it. So it's no point of gathering data if you don't use it, right? It is a repository that gathers health data from various sources. And primarily, of course, because the majority of 70% of the healthcare and the patients goes to the Ministry of Health, public health hospitals. But for KKM, we want the data that represent the whole of Malaysia, the population of Malaysia. So that 30% of patients who goes to you is just as valuable. But that's, of course, in KKM's perspective. But for your perspective, I'm going to highlight in the demonstration some basics, question, and analysis that might be insightful to you. So I hope at the end of this session, we can all contribute to Malaysian Health Data Warehouse and use the data that you have submitted to evaluate and improve your healthcare system and your institution. So with that, I'm going to start sharing the screen for the demonstration. I'm going to introduce my friend here, my colleague, Dr. Hafizuddin. He's going to assist me with the demonstration, but you're just going to see the screen. Right, so for those who submit data to Malaysian Health Data Warehouse, either through SMRP or PRIS or any other system, you would be given an access to the system. For you as a CEO, you don't need to have access to enter data because it is not your job, but you may want to have access to start looking at those charts and the reports, right? So this is the homepage, and I'm going to show you some questions that might be useful for you. For example, if you may have a lot of questions, basic questions such as, how many cases do I see every month? What kind of cases I see every month? What kind of disciplines or specialties, and how much are they seeing for each patient, for each diseases? You may want to know questions such as, where is the next hospital that I should build? Or if I want to employ the next specialist, which specialist should I employ and generate more income, for example. So we've actually requested and granted permission to use a sample from one of the hospital from the private sector. The reason is because our show is short. At KKM level, at my level, I can see, I can generate information from the whole private sector, but that would take time for it to analyze. So it would be faster for me to use some simple example from the one of our colleagues in the Selangor Medical Center. Right. So as you can see, it is the features is, we made it quite easy. It is a drag and drop feature. You don't have to do this, CAO, please. We do train your system, your people. I think we have completed training for all those who sent their staff to be trained by us, and they should be able to generate this report for you. So for example, if I want to know how many cases that I see every month in 2019, I can generate this table. I don't know, how many seconds was it? Less than 2 seconds? And you can export this data into a simple Excel. And if you don't like tables, it's okay. We provide the chart. You can choose the different charts available. You can amend it in terms of putting in a title and so forth. So all this has been trained to your staff, yeah? So you can start requesting if you don't know already. So this is where you, it's not just about giving us the data, but you yourself can actually start using this data and gain insights. Right, so this is basic questions. How many cases? Let's see if I want to know what kind of cases that I see for that year. So we use usually ICD-10 code, which is an international standard for the type of diagnosis. ICD-10 three-digit is quite high level, but if you want to know further, you can use 4-digit code, 5-digit code, and so forth. So my friend here is trying to show you the variables that is available for you to use and generate that information for us. Right, again, less than 2 seconds, great. Let's see, let's sort it up and see what's the most common one. Okay, well, for this hospital, we know that the most common cause of admission to this hospital is acute bronchitis, right? The next one is influenza, a J code, so that means a lot of respiratory cases. You might want to expand that respiratory wing and maybe hire some more specialists. It's one of those decisions that you can make once you get this data into information, insightful information. So I just want to highlight here, if you can see that there are a lot of discharges, balik ke rumah, but there are no death cases. That is something that can be queried. But I would like to congratulate some of this hospital who I know have been working with PIK on sending the data through system integration. That means when you send the data, there are 2 ways that's possible. The first one is through a web-based system where you enter the data one by one. Or if your hospitals or your institution has already implemented an IT information system, a health information system in the hospital, we can work together to integrate. That means you don't have to enter again. The good thing is your staff doesn't need to enter data many times, but we know that certain hospitals, the system doesn't have all the variables or the data that is well, not really required, but it's not mandatory, but what you can actually do more with it. So for example, here, even though the system is integrated, every patient here is categorized as going home. But if you want to get more insight of the data that you send in, actually, you can either improve the information system that you have, you can talk to vendors, your vendor, or you can ask your staff to enter and amend this data in the web-based system. So that's just a touch-up I want to show you, and maybe we can go to the next one. Because I think, to me, the data that we have is not to penalize anybody. I think when you start sending us the data, the first 3 to 6 months is about learning what the data is about, how we work, and what are the challenges that we can improve on. So maybe one last example I want to show you is, let's say, this is an interesting one. Let's say I want to know how many, who, instead of what kind of patient that I get, but who actually attend to my hospitals. So I'm going to take off the data for Selangor. I'm just going to generate the data for the whole of private sector in Malaysia. Of course, I'm not going to show you individual information. That will be breach of confidentiality. But let's say I want to know the nationality of the patient that I see in my hospital. So those who are, for example, who's involved in the Malaysian healthcare tourism would want to know where my patients come from, the foreigners, and where I can venture into. So yes, please give me time for it to run, because it will contain, I think, over 500,000 cases. So at our level, we have that ability because you send the data to us. But at your level, it will be much quicker. So these are some of the questions that you can actually find out, and you can learn from your data and which data that is important to you. And if you want to add on, if you feel that this is not enough, then we can sit down and discover how to work it out, which information is important. So, right, we have more than 500,000, yep. So Malaysians, of course, the most common one. The next one is those from Indonesia, China, oh, interesting, China, India, and so forth. And of course, 8,000 is not available. So to me, I'm not going to say that we're going to penalize and force you, but I think if you enter this data, it will be useful for you. It's not just for us. So that 8,000 is, I think, can be at your level. Once I think you can say that if it is important to you, you can always go down to your staff and say that you want this information and you want this data to be entered into the system. Okay, so those are some of the examples I've shown. Once you have developed your own regular report, for example, if you are already done, you want this data in a weekly or monthly basis, you can churn this report automatically. So the drag and drop is just once, and you can save the query, and you can get this information on a weekly or monthly basis or annually, right, to be sent to your email and so forth. So you don't have to do it again and again. In fact, we can actually work together and create dashboard for you. So far, we have not created any dashboard for the private healthcare sector, but of course, this is always open for discussion. We're just going to show you an example of a dashboard that we've developed for the Ministry of Health, because this is the requirement from the WHO. As you can see, one example is the hospital readmission rate. And as you know, this is a quality measure. For example, those are readmitted for diabetes, acute myocardial infarction, and pneumonia and asthma is one of the quality measures that you would want to show to people, maybe to yourself and to your institution, and how well actually you've been taking care of your patient, right? Another SDG or dashboard that we want to show you is our length of stay. We have a length of stay for the private, and this is for all sector. So for all sector is 3.88 for the year 2020. And if you see for the private sector, that's KKM 4.0 length of stay. And for the swasta is much better than us. And so if you want to generate this for yourself as well, and I think it is useful for those who always want to give a quality of care, high quality of care. These are some of the measures that you want to produce. Right. So I'm going to, my friend is finished with the demonstration, and I'm just going to touch up a little bit on the security and privacy measure. No, this is a very important topic. A lot of concerns actually has been going on, basically on how do we take care of our data. So in KKM, we always say that the data belongs to the patient, but we are the governance of the data. That means we are responsible to take care of the data and who it should be sent to, right? So based on research, actually, most common cause of data breach is actually internal stuff, rather than breach into the technology component. But still, we do pay attention to our security measures based on the latest security protocol. I want to explain this as simple as possible, right? For data that goes, every data that goes into a MyHDW warehouse, it will be split into two. The first part is the identification of patient, and the second part is always the data related to health, right? And once this data is separated, then the data analyst will only be able to analyze the anonymized data, the clinical anonymized data, while the identification is actually put on a separate database and a separate system. And what it does is actually, it secures the system. So if anyone breaks into one system, there is, they can, for example, if they want to know who are the patient, well, they can see a list of patients, but they don't know what the patient have. Or if they go into the clinical database, then they only know the data, but they don't know who. And linking this information takes a very long-winded process, and it's not easy to actually relink this information. So I want to touch a little bit on that privacy. And so if those who have concern, you can always discuss with us, but since this is a short presentation, that's how much that I can show you and assure you, right? So I guess the next question is, all right, I can access this data warehouse business intelligence tool for free. How do I submit data to PIK? Yeah? So there are two main systems. The first one is SMRP. There are many modules under SMRP, but I'm sure the most common one that you always use the inpatient and outpatient, or usually the inpatient data. So that means all visits to hospitals are gathered and into the SMRP module inpatient. But I want to show to you and share with you how much module that we have in SMRP. That means, for example, if you have a physiotherapy department or you have a traditional complementary medicine department, and you want to collect this data and analyze it, you can use SMRP modules to do that for free, and you can use the analysis that's already available for free. You don't have to build a new system to collect this data or employ a new business intelligence tool, because I know that sometimes before you want to maybe engage to an excellent business intelligence tool, this is where you start. And most of the times I can see that what my health data warehouse have to offer is actually enough before you can go to other big data analytics. Another system that we have is the PRIS module, Patient Registry Information System. So in Malaysia, we have a lot of registries for diseases to track down all these patients. In Patient Registry Information System, it is very clinical based, and it is headed by principal investigator. Previously and even currently, all these registries are voluntary based. That means you can join as on a voluntary basis. And usually the principal investigator will go around to universities and private center to ask whether the specialists are interested. So this is where, if your specialists are interested and if you are interested in to join, you can contact us at PIK and we can show you, direct you to the principal investigators and show you how the system works. Right, so that will be the end of my session. I hope we can join later in the Q&A session. I send back to you, Encik Shamsa.
Thank you, Yang Berusaha, Dr. Isra Muhammad Sulaiman, Senior Principal Assistant Director of PIK. It was a very, very informative information, and looking at exactly on the live version of the entire whole system, how does it work and how is the system goes around. Looking at just now, when I saw the demonstration, I noticed there's quite numbers of private healthcare facilities in Malaysia has also been adopting this particular system. One of the I understand that one of the private healthcare facilities has adopting this particular system is KPJ Hospital. And next, I would like to invite Dr. Aliza Jamaluddin, the Deputy General Manager Clinical Services of KPJ Healthcare Berhad, to share the implementation of KPJ Hospital by implementing MyHDW. And just allow me to do some introduction of Dr. Aliza. Dr. Aliza has been involved in clinical governance and activity for KPJ Group, developing and reviewing policies, and she also involved in implementing projects for clinical. Other than that, she also the coordinator for the group health information management system in KPJ Healthcare Berhad. Let's welcome Dr. Aliza Jamaluddin, Deputy General Manager of Clinical Services, KPJ Healthcare Berhad. Dr. Aliza, over to you.
Thank you to Haji Shamsul Arman for the introduction. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon to Yang Berbahagia Datuk Dr. Jacob and all present here today in this forum. I would like to thank MPC and also PIK who had invited us to present on our experience in implementing MyHDW. Next, please. Just a short introduction on KPJ. That is our building that you see on your left. Menara KPJ that is situated in Jalan Tun Razak, a bit further down from Pusrawi Hospital and IJN. And level 14 is where my office is, where the clinical services of KPJ is situated. Next, please. We have about 28 hospitals in Malaysia and 4 overseas. Our KPJ University College, there are 3 branches here in Malaysia and also a nursing college in Bangladesh. And we have started our senior and assisted living care with 4 centers in Malaysia and 1 in Australia. And we are supported by our ancillary services, and we have our ambulatory care and wellness centers. Next, please. Okay, going into our journey with SMRP, we were invited to attend a training by PIK in 2016, and from then onwards we had presented and developed our processes on birth and death notification to the management, and this was also presented to all the CEOs of KPJ Group of Hospitals during the hospital management meetings. And our integration of documentation was started in end of 2017. Development of phase 1 of the forms were done, and we had integrated for the admission and discharge book for using the JSON format, and this was implemented, and there was a trial run and training done by the PIK on the SMRP portal. And once it was a success, it was deployed to all our KPJ hospitals, and we carried out integration and data support, looking into data correction and verification by PIK, MIMOS, and from our IT personnel as well. So in 2018, one of our hospitals, KPJ Selangor, had managed to report 100% in the SMRP portal, and they had also managed to update all the backdated data from 2017 onwards. Next, please. Okay, looking at the SMRP process flow, there are some issues that we had encountered and managed to find a solution for that. System maintenance is open once a year at the end of the year. This is where the hospital information will have to be updated. If the information is incomplete or incorrect, then there will be issues in sending the data over into the SMRP portal. Most of the time, patient registration is done by other staff, and we have to ensure that the completeness and the correct information is being entered into the system. Otherwise, the HIMSS staff will have to update and correct back the information in the JSON format before submitting the data into the SMRP portal. The other issue will be that during admission, certain information has to be correctly entered or complete. Otherwise, the HIMSS staff will have to update again in the JSON format, because the report will not flow through into the SMRP portal. For KPJ birth notification process, we are manually entering into the SMRP website, and these are the information that is required and given to the portal. The same for death. Death notification is also done online manually, and information that is keyed in is based on the burial permit form that that we have. However, a word of caution is if you have updated incomplete ICD-10 code into the system, then the report will not flow through into the SMRP portal. Therefore, in death notification, it is required to put in the ICD-10 for cause of death and the MMC number of the doctor concerned. So in KPJ, we have 3 forms that we use manual entry into the system, whereas integration is done for the admission and discharge book. Next, please. So what are the issues and how did we start off? After the training and after all the presentation to the hospital CEOs and to the management, we continued to monitor how the HIMSS are doing from the KPJ group of hospitals by gathering their feedbacks using Google Form. What are the issues that they face? What are the solutions that they propose, and what are the actions that they have taken? So this was done quite regularly to ensure that they are on the right track, and any issues that they can't solve or any action that can't be done is forwarded to the IT and also to MIMOS and also to PIK. So that's how we kept on monitoring. And also there is also a WhatsApp group, and any issues that they have, it will be entered into the WhatsApp group, and those who have already found the solution will just convey to that. So in that way, information is cascaded down to all the HIMSS in the KPJ group quite fast. The other issue is the ICD-10 version 2010. So PIK uses version 2010, and we found out that we need to update our ICD-10, and we formed a committee to look into this, and once it's completed and verified to be correct, So it was deployed to all the hospitals. So in the ICD-10, we needed to enter the 5th category and also for the external costs. Otherwise, when you input the data, then the data will not flow through and they will have to review back. So there were a lot of discussion and training conducted, especially in terms of registration of patients and patients for admission, because the data is entered by another service. So they need to ensure that the correct data is entered, especially in terms of IC, passport, race, and all that. So this is to ensure that the HIM staff will not have too much of difficulty looking into the JSON file to correct the information there and before submitting the data. Thank you. We had a lot of help from PIK and MIMOS in this journey, and we had a lot of help from our IT, and there were also a lot of discussion and all that. So in March 2019, we were given to complete the data entry into SMRP by November of last year. So in March 2019, we had called for a meeting of all the operation managers of all the KPJ group of hospitals, discussed about what SMRP is, what are the requirements, and informed them. So at the end of the meeting, they were given a commitment date and they had to sign the commitment date. So at least about 2 months before the commitment date is due, we will follow up and see where they are. So there was a lot of requests for data from PIK to see where the hospitals are and follow up and monitoring of birth, death, admission, and discharge. So next, please. So we had the training with PIK and MIMOS in April 2019. So these are the people who made it happen. We had the PIK team there, and MIMOS unfortunately had already left the day before. So in short, there were a lot of issues that we found out and we had to find a solution and action plan on that. Next, please. I think I'm at the end of my presentation. That's all. Thank you.
Once again, thank you, Dr. Lisa Jamaluddin, Deputy General Manager of Clinical Services, KPJ Healthcare Berhad. For all the attendees, appreciate if you can send in all your questions referring to the MyHDW matter to our Q&A tab, and we would like to try our very best to answer every single questions that arise in the Q&A tab. For the next presentation, which is also the last, we reserved the best on the last presentation. I would like to invite Young Berusaha Dr. Nuraida Muhammad Mazuki, Deputy Director of Health Informatics Center, HIC, Ministry of Health, to brief on the submission and the future roadmap of MyHDW. But before that, just allow me to do some introduction of Dr. Nuraida. Dr. Nuraida Mazuki is a public health physician. Her educational background includes doctorate in public health from University of Malaya with a specialty on health services management. She previously served at various departments in Ministry of Health, including the e-health section, Planning Division. She has more than 15 years of experience in government-led health IT initiatives and responsible in projects such as Malaysian Health Information Exchange, MyHIX, which is one of the MOH interoperability platform between various clinics and hospital EMRS. As head of Health Informatics Center, she is now responsible for the National Health Information Standards, including as custodian for National Health Data within the Malaysian Health Data Warehouse, as well as to contribute for the success for National E-Health Strategy and Health IT Adoption. Please welcome Yang Berusaha Dr. Nuraida Muhammad Mazuki, Deputy Director of Health Informatics Center, Ministry of Health. Dr. Nuraida, over to you.
Hello, Arman, can you hear me?
Yes, I can hear you loud.
Okay, thank you very much, Arman, for the introduction. Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon to all the attendees. So I will actually continue my presentation. Thank you, Dr. Aliza, for the sharing session of how private healthcare hospital can make use of our MyHDW, as well as how my KPJ, the group, can get benefits out of the system. Next slide. Smart. So what I can share with you all is actually what is MyHDW is all about. It's about the administrative requirement for data collection for MyHDW is from the 586 Private Healthcare Facility and Services Act. And we also has this peraturan where in which all the healthcare facilities is required to actually to submit the hospital statistic in order for the license renewal. And to ensure the governance and the tadbir urus of the MyHData, we have di surat Ketua Pengarah Kesihatan makluman pelaksanaan penggunaan aplikasi SMRP 2.0 bagi modul pesakit dalam dan rawatan harian di semua hospital swasta bertarikh is dated 28 October 2016. So we have this official peraturan for the private healthcare facilities actually to submit the data to the MyHDW, and of course all the Ministry of Health facility is mandatory for them to actually submit the data for the purpose of national statistics as well as data analytics and for healthcare planning. The data collection that we do actually is through the e-reporting as well as the SMRP. And what we have of the submission status for the inpatient module admission, we have 41% submission rate. That is about 110 out of 214 private hospital. And the inpatient labor room, we have 90% submission. That is the 75 out of 192 facilities. And the daycare module is about 39%. So we see the increase in the submission is quite promising. We have hopeful that the private facilities can actually improve and try to actually submit their data in order for us to get a more holistic picture of the national healthcare status, as what Dr. Ismat presented earlier. In terms of the way forward, what we see is actually that the continuous training for MyHDW will continue. As said by Dr. Ismail just now, we are open to whoever that wants to get training from us in terms of how to use the system and to make the data submission better. And for 2022, we are actually gradually transitioning the old system, the e-reporting, towards SMRP in MyHDW. And one thing we would like to add is actually we have used this ICD-10 since 1998, and we actually transitioning to the new terminal diagnosis coding ICD-11. Where next slide, please. Next. Where actually we have the mandate to actually implement this ICD-11 for international health reporting from 1st January 2022. Previous slide. Okay. So I will continue to actually present about the status of submission. We can see that from the previous picture of about 40 to 40%, I think on overall we can see that actually this percentage of hospital that has implemented at least one module from the MyHDW module. For police, there's only one hospital. I think that's 100%. Congratulations on that. But I think from Johor, Kedah, Kelantan, Melaka, Negeri Sembilan, Pahang, Perak, Pulau Pinang, Sabah, Sarawak, Selangor, Terengganu, wilayah Persekutuan Kuala Lumpur, we hope that there will be more private hospital can participate and actually contribute to MyHDW in terms of their data in the form of SMRP or e-reporting. What we want to see actually, as Dr. Ismat explained earlier, when we have to actually produce reports for the top management in terms of decision making, the disclaimer that we need to put there is sadly is actually this data is only contain data from the public MOH hospital, and it's not actually the whole picture of the Malaysian healthcare system. Okay, next. So I am continuing about the ICD-11. So this ICD-11 is actually diagnosis coding that we adopt in order for us to do analysis and reporting for the prevalence of diseases and etc. So I also would like to take this opportunity to actually announce that we, MOH, actually spearheading this effort in order for us to transition from ICD-10 to ICD-11. This process has been started since end of 2019, and we are actually in close collaboration with the WHO in order to make this happen. So we have actually organized this training earlier this month, and there are participation from the private sector as well as private vendors in order for us to make this work or implemented for the adoption of ICD-11. So I think for now, this is not something that the private hospital has to adapt, but we in the Ministry of Health will try to have the gradual transition from ICD-11 to ICD-10, in which this ICD-11 is more, has more codes in terms of capturing new diseases, as well as they don't need to actually to refer to the 3 volumes, big volume that Dr. Aliza presented earlier. So there is online coding tool, this embedded coding tool that can be implemented and integrated into the each individual hospital. I think for now, we will actually, with that, there's nothing else that that I can show you. I think I can hand over to you to Arman. So far, that is my presentation for now. Thank you, Arman. Over to you.
Thank you so much. Thank you, Dr. Noraida, Deputy Director of PIK KKM. And now we come to our next session, which is the Q&A session. And for this session, we have 3 panelists to be in this session. The first one, not other than Dr. Noraida Muhammad Mazuki, the Deputy Director of PIK. Second panelist, I would like to invite Yang Berusaha Dr. Ismat Muhammad Sulaiman, Senior Principal Assistant Director of PIK. And third, I would like to invite Yang Dr. Arasu Raju, which is also the Honorary General Secretary of MMA. Dr. Arasu, welcome.
Thank you, Tuan Haji Aman.
Okay, let me introduce Dr. Arasu to the attendees. Dr. Arasu has been in the practice of medicine for the last 14 years, and he is currently the Honorary General Secretary of Malaysian Medical Association, MMA, and representing MMA in various national committees. Some of the committees that he is a member, including Dasar Ubat National Antimicrobial Resistance Committee, National Committee of the Managed Care Organization, and also Malaysian Adverse Drug Reaction Advisory Committee. Dr. Arasu, as known among the fraternity, is a practicing general practitioner and founded the Polyclinic Cahaya Group of clinics and recently Care Clinics Healthcare Services in Berhad. His group practice operates 25 clinics in the Greater KL, with all the clinics are connected via electronic medical records. His group adopts to IR 4.0 and moving towards patient-centered care and value-based healthcare by adopting innovation and technology that benefits the patients. And Dr. Arasu is also the co-leader for Technology and Innovation Working Group for Private Healthcare Productiveness, which is also one of the main drivers for today's CEO Forum of MyHDW. Welcome all the panelists.
Yeah, we are ready here, Arman.
All right, okay. So let me just start with some of the questions from the ground. Or perhaps I will start with my question first. On MyHDW, as a newcomer, would like to adopt MyHDW, what is the requirement to participate in My Malaysian Health Data Warehouse?
Yeah, Arman, thank you for that question. Perhaps I can answer on behalf of KKM and PIK. We are actually the program owner, so we actually state what are the requirements. Basically, just an internet connection and a PC, because our system is a web-based. So, however, whoever that wants to have the access must actually register to PIK. The registration process involves filling a form in which the user to be authorized by their supervisor or the hospital director or the head of department, so that this email or address this user will be authorized and authenticated in order for the end user to get the access. In terms of what kind of level of access, that depends on what is the purpose of the user to get the access, whether to actually for reporting or to just submit the data. Anything else, Ismail, that you want to add? Yeah, that's it. That's the only requirement. Yeah.
All right, thank you, Dr. Nuraida. Okay, let me just go through one of the questions from the attendees. Okay, this is on the security matter. How would this data to be secured, and how long will this data to be stored?
MyHDW is built upon the security infrastructure that actually considers whatever the security standard in IT security. MIMOS actually have their own way in terms of multi-factor authentication process, where every user that have to have access first, they need to be authorized first by us, and then when they want to actually log into the system, there are several authenticated process in terms of a digital certificate. There are various ways. Digital certificate is one, and then password as usual, and then we have this application called MyTCK, where it's like when you do online banking that Maybank to you, where they send you TAC, tag code. So we have the same methodology in terms of authenticated the user that want to log in. So the end user need to submit the MyTCK within the system when they want to access the system. In terms of how long the data is recorded, well, basically the usual government regulation is actually we have to keep the data for at least 7 years. But I think within the digital data so far, we have not made any decision yet. So far, whatever the data that has in the MyHDW, we can keep it, and we have backup for the data. So whether decision where we want to actually to purge or not, we have not come to that decision yet. Yep.
I think I can summarize on the security. If I may add, Encik Shamsul, is that okay?
Yeah, Dr. Ismail.
Just I guess a summary on a user perspective, the data is secured in two facets. The first one is how you access the data as a user and how the data is stored. So Dr. Nuraida explained just now how to access the data is where we put on several layers of authentication. So it's not just, everyone can log in and put their passwords in front of the PC and everyone can enter. So it's a multiple authentication, and we now use a lot of mobile phones. So that's one way. And I think the data, how the data is stored, I presented just now. That's how the two method how we secure our data.
Thank you, Dr. Ismail. There's one question I would like to just get some idea from Dr. Rasul. Dr. Rasul, as you are also the co-leader for the technology and innovation of PHPN, and with PHPN helping to push to the nationwide the utilization of MyHDW, what other expectation of PHPN besides KKM sharing the output from the information gathered in the systems?
If you look at the, thank you for the question, Tuan Haji Arman. See, basically, as we all know, the world is moving. I mean, we're already in IR 4.0, and big data analytics is a very core component of an integrated healthcare system. And more so in Malaysia, we have the private and also the public sector dichotomous. So how do we come together? And there are lots of data being captured in the private sector, which is very, very useful when it comes to policy decision making. And also we believe that the private hospitals are also using it for their own decision making in terms of commercial decisions or also their own internal decisions. But here, what the MPC is doing is that MPC is basically playing a bridging role. Is playing a bridging role, being under the leadership of Dr. Jacob Thomas, being a private healthcare productivity nexus. It plays a role. It understands the private sector very well, but it also has the connection with the government sector, and is a bridge. So what the hospitals can do is that they can make use of these PHPN, and after all, they are already represented by APHN, whereby Dr. Maha is one of the panelists, one of the leaders there, a panel member there. So we encourage them to make use of PHPN to bridge this gap.
Thank you, Dr. Asu. Let us just go on to some other questions that are from the floor. This one is from one of the attendees, and he would like to know if a new developer or the operator would like to undertake feasibility study to gauge whether is it ideal to set up a private hospital, how would this system be helpful?
Yeah. Thank you, Arman. Thank you
Yeah.
for this question by anonymous attendee. In PIK, we actually receive requests in terms of set up. We call this environmental impact assessment. I think it also applies for whoever that actually intend to establish or build a new hospital, where we actually can provide in terms of the prevalence and the population density of a geographical location. And we, in our GIS platform, you also have the taburan facility, the government as well as swasta. I think, how actually this individual or particular interest want to actually have access, I think they need to actually write officially to PIK to get the data. We cannot actually share it openly. Yeah, it's need a special request to PIK.
So which means if as a developer or newly developer or hospital operator would like to understand that particular area in terms of the geographical or whatever services is already available, PIK can write in officially to PIK and request for the data, is it?
Yeah, it's we write officially, but whether it's entertained or not, we actually need to have a further discussion lah in terms of. I
see. All right.
Yeah.
Okay. Thank you, Dr. Nuraida. And just now we're talking about the new hospital. If as an existing hospital, how would this system be able to guide the CEO to develop their subsequent business plan?
I leave it to Ismat to answer it.
Okay, Dr. Ismat.
Sure. I think I gave several examples of the question that you can ask and get. It really depends based on the data that you submitted and the questions that you want answered. So do you want to extend based on the population? Do you want to extend based on the disease burden? Or do you want to extend based on your cost and market analysis? For example, if I want, is it better for me to build a hospital or a daycare? Then your data, whatever data that you have given and submitted to MyHDW Warehouse, you can see that which one gives you maybe the most benefit in terms of cost for you to help you decide whether you want to build a daycare center or not, and then which specialty you want to, based on the type of procedures that you do. If you see that the most common procedure is maybe deliveries, then maybe that's the daycare center that you want to open up. So it all depends on your data, basically. So I can't answer that. And if you don't send me the data, I don't know, and you won't know either. Yeah.
Exactly. I think at the end, at the bottom line is everyone to make the analysis work. The most fundamental need to submit the data, key in the data, then only let the system work for you. There's nothing in miracle. Okay, without key in the data, there's nothing miracle just suddenly can come up with it like this, right? No.
Yeah. It's absolutely correct, and I concur with you.
Tonaji, can I add something? Because
Dato'.
If you talk about the private healthcare sector, the patients who go to a private sector and the public sector might be a little different from their background. So, as was just said very correctly, if the private hospitals don't support it and give the data readily, and if the PIK doesn't have a good set of records and feedback, the data which they give will not be very accurate. So that's why I think the more we use it and more it should become a way of hospital to always give the data readily, and I think we can make use of it. I know of many studies done where the data is very weak and hospitals have gone ahead and put up services which is not used much in the end because they depended on some other data. So I think the more we use it, the more beneficial it will be for us.
Thank you, Dr. Jacob. And this one, to talk about data and also the type of the software or the tools that we are talking about. One of the attendees, KSO, posted the question, why do we need this data house where you can just upload the data on a specific website, similarly to Data World for all users to use Power BI or Tableau to do the analysis? Tableau or Power BI can do better analysis than what just shown. We just need to set up a connection to the specific server and a lot of and allowing all the hospital or any consultants to retrieve data for analysis. Perhaps PIK can respond to this comment.
Yes, I think I can try.
Right.
I like this question actually, because it is someone who is critically thinking and what's the best option for them. My first, I guess there are several aspects. The first one is you or we are exposing our patient data to the public. Yes, you put it in the cloud, but you are exposing the data to the public. And you may receive VIP guests, and I'm sure your VIP guests will not agree that their data, whatever disease that they have, is out there in the cloud. Secondly, based on experience, most of the data that is submitted to the cloud are aggregated. Aggregated means there are numbers. Those data that is submitted to PIK is granular. That means individual patient. We used to develop such system that the hospital send to us in numbers. How many numbers of patient has acute bronchitis, for example. And what we find with that is people manipulate the data. As much as we want to trust the people who send us the data, there were evidence to show that these data are manipulated. So if you send the data in aggregated form to these various very canggih BI tools, it all goes back to how much can the people trust the data. When you look back, how much you as a CEO can trust the data that was entered by your staff because it is aggregated. It is not linked to any individual patient. So the second issue is trust. The first issue is confidentiality. And I guess the last one would be, it would be not just KKM's loss, but also Malaysia's loss. That if you send this data to Tableau and Power BI and not send it to MyHDW warehouse, we will never get the picture of the whole Malaysia healthcare status. So that will be my answer. I hope that satisfies some of your critical and critics.
Dr. Nureda, want to add on anything?
Yeah, I think the utmost importance is actually to preserve the privacy, confidentiality, and MyHDW has all of the features in order to safeguard the security of the patient data. As Dr. Ismat mentioned earlier, if you extract all the data and we post the data so that everyone can have a look and then post it and use it within whatever the BI tools that everyone can have the access, we must understand our responsibility when we handle the data. So MyHDW is the agency, the authorized agency to actually to handle this data, and we have the honor actually our responsibility to make sure this data is to be secured. That's it. Yeah.
Okay, thank you, Dr. Nurida. Okay, for all the attendees are still available, are still online. Okay, I have just received the request from the Secretariat that we are actually allowing maximum 2 participants that ask a question online via microphone. So for any of the attendees who would like to ask directly, please raise your hand in your tab, and we will then allow to unmute, allow you to talk, that you can ask your questions directly to any of the panelists. Due to the time, we only allow maximum two questions, two persons that are asking the questions. Okay, while waiting for whoever the lucky one who can ask online, let us continue with our written questions. Okay, in the new hospital which is in the midst of forming his HIS system, what would be the advice to allow integration of the HIS system which hospital intended to with the SMRP system? Dr. Ismail or Dr. Nurida?
The Nurida is trying to find the question, but when she's trying to find,
okay, if it's in the new hospital, they are in the midst of forming the HIS. All right. So what would be the advice to allowing the integration of HIS together with the SMRP system?
Yeah, we have a data dictionary.
Yeah. For now, PIK will, for whichever hospital that intend to integrate with the SMRP system, can be in contact with us. Our technical will assist, and we have several steps, and we are actually in the form of forming a toolkit for the integration to take place. Basically, it involves several steps. Actually, we will show whatever the variables that we need in our SMRP, and then we check back with the HIS is the variable is available or not, and then the integration usually takes in the form of JSON format. So the integration in the JSON format that we want, as long as the HIS comply to whatever the security as well as the data dictionary, then the system is well to go for the integration. That is one option lah. The second option is just actually to enter data manually to our e-reporting.
Well, I think I'd like to congratulate whoever asked that question. That means they're thinking ahead.
Yeah.
Every module that we build, we have a data dictionary. That means a master variable. And with that, all the variables and the definition. So based on that, you can use the data dictionary for the modules that you are interested in and use that to build your system.
Okay, thank you, Dr. Narendra. Thank you, Dr. Isman. The next question is to Dr. Arasu. For Dr. Arasu, what are the actions that PHPN is planning moving forward in cooperation with KKM that will help increase the awareness of MyHDW? Is there any training for all the private hospital or any plans so far?
Thank you, Dr. Jerman. In fact, we had one training in Pantai Hospital last year. And then we have actually planned out to roll out a couple of trainings based on the zone, northern, southern, east, west, and also Sabah, Sarawak. Unfortunately, because of COVID-19, a lot of things has been postponed. But having said that, and now with the various online trainings, we are also planning to roll out a couple of trainings. These will actually help the private hospitals, whereby we understand that with the human resource and also training facilities, PHPN can facilitate all these things. And this will also help the CEOs over here to ensure that their staffs can also follow up by not leaving their hospitals while working. They can also be trained. So these are some of the things actually we already have in the pipeline, and we sincerely hope that the CEOs will also support by encouraging their staffs to also participate.
Dr. Arasu, I just want to ask a question. This will this also involve GPs, because they are the backbone of healthcare, and we have more than 7,000 over GPs in the country, because the data they have, even though it's outpatient, I think, will that also be something, or is it already being collated?
At the moment, Dato, under the requirement by certain acts like Infection Prevention Control Act, it is compulsory for us to give a notification for some of the communicable diseases, and also for this immunization data. So we have also asked MOH, why don't we make that as one of the, since we are already mandated to do, probably they can have a system whereby all these data can be centralized. Like for example, we have e-notification, and then some Jabatan Kesihatan, they have their own systems. So we have also asked them, why don't we make it centralized? After all, we are already submitting the data. And also we are trying to encourage the GPs, the importance of data collection. And that goes again on the data, the kind of data they capture at the clinic level as well. It's an ongoing process.
Thank you.
Thank you, Dr. Rasu. And okay, on there, let me just go through some other questions here. On the SMRP systems, just out of curiosity, can I know, is there any other system being used by the private healthcare to collect the data of their patient? If yes, do they need to re-enter the data in SMRP system? Maybe this might give the private system some trouble in terms of entering data because they need to key in twice in the different system. Can I know what is your opinion on this aspect? Secondly, is it compulsory for all the healthcare facility, or this one I will believe that all the private healthcare facility in Malaysia to use SMRP system? Third, can I know which country has the best medical facilities? I believe that this is referring to the systems. Okay, yeah.
Okay. That's a very long question. First, is there anything with the private to collect that? So far, from PIK, we have the old system, the e-reporting system, and the new one is the SMRP in MyHDW. But if the hospital or the facilities has already submitting data to the SMRP MyHDW, then they need not to submit through the e-reporting system. Yes, we do not actually want to burden for double entry, whereas if whether from the private or the government system. And the second one, is it compulsory for all the healthcare facility to use the SMRP system? Well, what I can say is actually we currently do not have the regulation or whatever peraturan to actually say that SMRP is mandatory. But there are peraturan in which for the license renewal under the Private Healthcare Facilities and Services Act, where they need to show the hospital statistic or submission in order for them for license renewal, as well as like Dr. Arasu say, for the disease notification and immunization. And one more, I think, in terms of what else? One that's mandatory. I think that's it. But can I know? And then next question: can I know which country has the best medical facilities? What country mean international or local? I guess is I think local. The best medical facilities, I think it depends whether it's private or public. We need to see in terms of how we decide is it the best, whether in terms of the lowest morbidity or the lowest mortality, or in terms of patient experience. So I think we need a special exercise to actually decide which country has the best medical facilities. I think.
Yeah, I think that question is like one whole PhD paper.
Dr. Nurida, as you mentioned just now on the compulsory submission of data, is it a penalty? Well, I believe that it is not compulsory to use MyHDW, right?
Yeah.
So, which means there's no penalty if they do not use MyHDW to submit the data. But under the Act, under the law, they must their private healthcare facilities must submit certain data to the government for the purpose of licensing. Am I right?
Yes, correct.
Okay,
the one thing that I forgot just now, one thing mandatory is for the cancer notification, in which we have latest peraturan surat daripada Ketua Pengarah Kesihatan, Pekeliling Ketua Pengarah Kesihatan, that says that every cancer notification is mandatory. Likewise with the disease notification, and the notification should be done through the MyHDW. Yeah.
Okay. The one, but for the cancer notification must through MyHDW, is it?
Yeah.
Okay. All right. Understand. All right. Okay. This is the next one from TS Muhammad Sharafi Mansoor. Assalamualaikum, Dr. Ismat. This MyHDW is a statistic base. Can this system combine with GIS so private and government sector can improve the service and upgrade our hospital just by see the pattern of disease in the population? Can this MyHDW help private sector in improve of quality and safety of patient during this by just seeing the interpretation of the data?
Yes, short answer. Long answer. The GIS is actually has been integrated into My Health Data Warehouse. I didn't get to show you other components of My Health Data Warehouse, such as text analytics using MyHarmony, and then we also integrate GIS. So if you want to know those daily daily reports for COVID-19, uses our GIS in My Health Data Warehouse. So if you have a COVID case and you submit that data to SMRP and into My Health Data Warehouse, we will capture it, right? As for the use of private health sector using the GIS, we are still working on it. The reason being is we need to make sure that the data that we publish in a public space is not misused, because people can misuse the data and the information. Yes, we have discussed this a lot using GIS for the private sector, especially in tabling out maybe where is your next hospital and so forth, and your next clinics and so forth. So that is still in discussion.
And Dr. Ismail and Dr. Nuraida, I did read one of the report in the Merima much earlier when my health data warehouse is forming, that it is supposed to aim for both private hospital as well as clinics. But at this moment, it's only the private hospital that is rolling out. How is the rolling out for the clinic, especially the GP section, as what Dr. Jacob is saying? Well, the GP are the backbones of the entire whole healthcare system. And Dr. Rasul, as also from MMA, any comments on these things?
It will be a long process, because actually if we were actually to collect data from all the private GPs, then we need to get everyone to be registered to us first. So yeah, so I think looking forward, yes, we are objective about that, but let's do it gradually, and whatever. I think in terms of how we can cope with all the user, I think there's about 40,000 of private GP. Dr. Arasu?
7,000, Norida.
7,000.
Private GP 7,000, yeah.
7,000. 7,000. Yeah, 7,000. But how many doctors are there working in the private GPs?
Probably close to 8,000.
Yeah. So 8,000 end users that we need to actually get to them to be registered and trained to use the data, and we actually need to see what kind of data that need to be submitted, because we, in our experience, it's very difficult actually to say that every patient that comes into the clinic, they need to key in the data. So what are the pertinent, the important data that need every clinic should submit? So I think the further requirements need to be get from the both parties, and how the data that we collect can be benefit with all the parties involved. Yeah.
Sorry, Dr. Norida, just a correction. We have more than 8,000 clinics actually. 8,000 clinics, that includes solo specialist clinics, which also comes under the this one. Just to correct.
Yeah. We will actually we in close collaboration with the CCAPs in terms of actually updating the registries of the clinics is one process. So, and when we get the finalized list of this clinic, then we need actually to get it put in data in terms of assigning their unique codes and their location for that thing.
I think when it comes to the module, it's we already have an outpatient module, but PKM do know that there are certain clinics that are single clinics and there are those under groups, right? So the burden of having single clinics to enter data compared to those who are under groups, it's actually very, very huge. So we need to consider that, and we need to engage not just what PKM wants from the GPs, but how the GPs also can benefit. What really is the pertinent information that we want to collect, that so that both sides can benefit.
Okay, thank you, Dr. Rasul. Thank you, Dr. Ismail. Thank you, Dr. Nuraida. It's almost like 5 o'clock now. I think we will just answer a few more questions here, and we will end the session today. Okay, this is from J. Muhammad Azhar Abdullah. What happened to our foreign patient data, since my health data warehouse is only meant for Malaysian patients?
There is no segregation in my health data warehouse. Whoever sees you, whatever color they come from, and if you enter those data into data warehouse, we collect it. So one of the example was knowing the nationality of your patients.
Okay.
I think perhaps I can clarify. We actually do not, although we get the granular data, but we actually do not have the full clinical information or clinical history or whatever the details about the patient. What we need actually, the data is like the nationality, the gender, and the diagnosis of this child, and so on and so forth. Just the pertinent information of one particular patient or the group of patients. Yeah.
Okay, talking about the KPI, the reporting of KPI, National Patient Safety Goals, will this also link to this database?
I think I can comment on this. PIK ourselves did not actually make a correlation from the whatever the data we collect in terms of national patient safety. But however, I think the department involved may ask from us about the data that they need in order for them to make decision with regards to this national patient safety goals. Yeah.
I have a comment there. I think let's start and get the health data in first. If we complicate it with too much, I think they will be reluctant. And maybe we start with this first and see how it goes. And I also, before you end, Tuan Haji, I wanted to add the first session in Pantai, which Dr. Ismat and the team facilitated. I think Dr. Rohaizat was also there. It was an eye-opener. Today is even better. We had almost 200 participants, CEOs who heard about it. So it's gone one step further. And I think what the PHPN will do is to continue to have these sessions, maybe in smaller groups, or have forums, and so that we can gradually answer the questions, because from what we hear from Dr. Noraida and Dr. Ismat is, it is not all that difficult. All you need is an internet line and have a system in place. So I think we need to keep pursuing, and I think the PHPN is committed to make sure everybody supports this, and that is why we got this initiative and try to use an occasion where we can get maximum partnership. So we'll continue to work with PIK to see how we can continue to generate interest and answer the questions. And I must thank Dr. Aliza for showing that private hospitals can do it and how they have done it well.
Thank you, Dr. Jacob. And this is also, since Dr. Jacob is also talking about PHPN is moving forward together with PIK and promoting this, the whole initiative. Just would like to ask Dr. Rasul, other than, besides My Health Data Warehouse, are there any programs that currently PHPN, especially the Technology and Innovation Working Group, are taking on, or any other things that is in the planning currently?
Yeah, thank you, Tuna German. I think this is a very important thing. Actually, we have been working very hard to finding out a mechanism on a partnership to maximize the utilization of underutilized medical technology resources. For example, MRIs, CT scans, or various services provided by the private sector with the Ministry of Health. So we're also working very hard on that, and also the health information exchange to allow sharing of medical information of patients. As we are aware, when a private patient, they are transferred to the public hospitals, or the public hospital, I mean, either way, the entire thing is done again. So we are looking into all these things. So basically what we are looking is that we are looking into each processes and how can we address these issues one by one using the PHPN platform.
Okay, thank you, Dr. Rasul. This is the another question that just actually come is from me myself. Would like to ask a PIK. At this moment in the data, how many private hospital actually already submitting this particular to the systems? And is there any from the past few years? Is that what is a major issues that or major stumbling block from you receive the feedback from the private hospital? Why are they reluctant to submit the data? Perhaps there's something that maybe PHPN is also can work from this particular angle so that it can promote to more exactly go into the root of this particular feedback so that it can promote this system to more private hospital.
Okay, Arman.
Yes.
Yep. From our record so far, we have about 110 private hospital that has submitted the data to MyHDW.
110, that is about 50%, right, Dr. Jacobs?
That's right, 51%.
Yeah.
51%, yeah.
51%, yeah.
Yeah.
So I think from our experience, I think the major stumbling block, I think first, perhaps maybe we didn't actually have full awareness. I think we have. I think there's one thing that we admit that we actually need further collaboration. I think MPC, this Phpn is a great platform for us actually to share about our system as well as how actually both of us can gain benefit from this MyHDW. And then the second thing, I think perhaps technology. I think like based on the question that we see just now, people are still thinking that only hospital with system that can submit to MyHDW, but now perhaps now we can share that it only takes a PC and internet connection and just to be registered to us so that they can submit the data that we want. And then the problem also that we see is perhaps the high turnover of the person in charge in terms of submission of data. So this, I understand the system is not perhaps a little bit complex, but I think we have to focus what are the data that just you want and then get the data that to be submitted. So moving forward, we invite whatever the hospital actually to contact us for retraining session. And I think the third one, I think is the issue of how when we want to be registered, you need to have an institutional email. That's one thing that we need to emphasize because we need to make sure only authorized and authenticated users to log into the system. That's why we impose that kind of rules. So we think that smaller hospital perhaps may start to actually subscribe to more a formal email rather than letting your person in charge to use a domain email like a Gmail or Yahoo to be registered to MyHDW. Yeah.
Okay, thank you, Dr. Nuraida. Just before we end the section today, I would like to invite all the panelists and also Dr. Aliza just to give your last word on before we end the whole session. Perhaps we can start with Dr. Ismat.
Sure. Let me see. I think I started with benefit realization. So I want to end with that as well. Some of the questions asked whether this is mandatory, if there's any penalty. No, there's no penalty, at least not yet. we haven't picked out our sticks, you know, we're still giving carrots. Yeah, so benefit, it is really to your benefit. Of course, when you give the data, we would benefit as well in KKM. But the main idea now is actually whatever data, it should not just be stored in data warehouse. You should use it. You should use it for whatever purpose. Yeah. So that
okay, thank you, Dr. Ismat. Dr. Rasul, any additional word?
I believe Phpn is the right platform to break the silo between the public and private. So let's make use of this platform and connect these two public and private sector for the benefit of our patients.
Thank you, Dr. Rasul. Dr. Nuraida?
Yeah, I also would like to thank MPC and Datuk Jacob and Phpn for giving PIK and MOH the opportunity to actually to break the silos between the public and the private. I hope we will move forward and we get benefit from this two collaboration as well as from the private sector for the MyHDW and for the benefit of Malaysian healthcare system. Yeah.
Thank you, Dr. Noraida. And Dr. Liza, as a user from MyHDW, any of the recommendation or to all the attendees?
I think what is important is to understand the process from where it starts until the end, because the HIMSS is the process starts at the end when the patient is admitted, goes through the flow in the hospital and gets discharged. So you need to see what are the issues that will appear from the start the patient registers to see a patient, when the patient registers to see a doctor, or when the patient gets admitted. So the whole process starts from there. If you can correct the process well, that means training and also continuous monitoring, then you would not have so much of problems of submitting the correct data. Thank you, MPC, for inviting me, and PIK for inviting me at this platform.
Thank you, Dr. Liza. Last but not least, I would like to also invite Dr. Jacob Thomas, the champion of PHPN, to say a few words before we end the whole session. Dato, are you on the line?
Yeah, I'm still here. Again, I just wanted to say this session again was fantastic. I was just putting myself in the shoes of someone listening for the first time. I think I would have been motivated to take part in this. And we heard it's 51%. I think by next week it should be 65%. And we will keep going, and we have to keep going. Don't get disheartened. It will take a long time because there are many issues. We just keep addressing it. So you're not alone. PHPN will be with you, and I think you have a great team. Dr. Noraida and Ismat, and even Nurul has been helping us a lot. So in all our sessions. So I think I must say that we definitely have a good future ahead. And I think Dr. Eliza, your example of what KPJ has done, and I think in KPJ, if you look, there are different types of hospitals, small ones, big ones, world-class ones. So you have done it all over. So there's no reason for someone to say we are too small or we are just starting. So you are a fantastic example, and leading this whole effort is Puan Nohaizam, who champions our technology and innovation. So she will also work with us to push it. So we will keep going at it. We'll work together. Thank you.
Thank you, Dr. Jacob, for the word, and for all the attendees. The secretary and also would like to request you to fill in the evaluation form. The link has been posted in the chat box. We will appreciate your response on this evaluation by letting us know how can we improve on the next session. At the end, I would like to thank everyone for attending this particular session for today official launching of technical design reference for disaster preparedness in setting up a new higher private hospital, and the COO forum on Malaysian Health Data Warehouse on the 30th of November 2020. Thank you, everyone. Thank you. And please stay safe, stay healthy, and stay productive. Thank you very much. Thank you. Assalamualaikum and goodbye.